And the guy that I get to speak to is a good long-time friend of mine too, Jay Sanguinetti. He's a PhD neuroscientist doing some awesome work. All right, cool. So let's get started. So let me timestamp this. Simultaneous squeeze. So first today we're going to be talking about tachycardia, the calming effects of the vagus nerve on the heart, blood pressure, bradycardia, all these kinds of things. Very heart-related subject today. But first, we're going to do our simultaneous squeeze, which is a Valsalva squeeze. So how you're going to do that is you're going to take a big, long inhale through your mouth, fill up your lungs completely, and then you're going to hold that air in, and then you're going to squeeze with your stomach, your diaphragm, and your chest, like you're trying to blow out a balloon, but your mouth is going to stay closed. So you're going to go like this, like air is retained in your mouth. You're going to get a rush of acetylcholine going through your brain. You're going to activate your vagus nerve, and it's going to kind of feel nice and like, ooh, groovy, baby. So then you're going to slowly exhale for 5 seconds after holding for 5 seconds. Okay, so here we go. Ready? In 3, 2, 1. Simultaneous squeeze starts now. Sip of air at the top. Hold it and squeeze. And slowly exhale. Good. Okay, good. That feels so good. I love that feeling. It's so fun. All right, cool. So let's get into it. So as far as the subject of today, the reason I chose this subject was because a woman asked a question in the Facebook group. And she had a number of really concerning symptoms that mentioned things like tachycardia, high blood pressure, dysautonomia, dizziness, all the real problem children of a dysfunctional vagus nerve, if I'm being honest. So I really wanted to do my best to potentially address some of those, main concerns that she might have, and hopefully try to answer some things related to this vagus nerve heart relationship. So in understanding tachycardia, which is the main thing we're talking about, let's start here. So tachycardia is a common it's a condition that's typically indicated by an abnormally fast heart rate, basically. It can be a cause for concern. Anything above like a constant heart rate of 130 beats per minute while sitting or laying down could be considered tachycardia. Your heart rate shouldn't, while laying down, be above like 110. That's pretty bad. So one often overlooked aspect of this dysfunction is the vagus nerve. It's often ignored. So in this video, we're going to explore the relationship between tachycardia and vagus nerve dysfunction, how one leads to the other, as well as the impact of the vagus nerve on blood pressure through the baroreceptors of your heart, which are also vagus nerve receptors. So your vagus nerve has a lot to do with heart rate and blood pressure. And additionally, we'll delve into the beneficial effects of vagus nerve stimulation in managing blood pressure, heart rate, and other heart-related functions. So very important video for today. Because, again, the number one killer of people today is heart failure, heart disease. So it's very crucial and very relevant to, I think, everybody who's alive and breathing. So where to begin? Let's start with the vagus nerve and heart rate regulation. So when it comes to the vagus nerve, the vagus nerve is the 10th cranial nerve. It plays a crucial role in regulating heart rate. It acts as a communication pathway between the brain and the heart, transmitting signals usually on the right side of the right vagus nerve fibers down to the heart. It acts as a communication pathway, and it transmits signals that help maintain a balanced heart rate. So when the vagus nerve is functioning properly, it releases acetylcholine, which is a neurotransmitter that slows down the heart rate. So acetylcholine sprinkles on the heart rate, on the heart, and it slows down. It has a refractory brake mechanism on the next heartbeat, which slows down beat-to-beat heart rate. So when the vagus nerve is more active, it can help to slow down the heart. Now, that doesn't mean that stimulating your vagus nerve will continually slow down your heart. So if somebody has bradycardia, stimulating your vagus nerve doesn't necessarily mean that your heart is going to go slower. We've explained this in another video, is that stimulation of the vagus nerve does not mean things go up or that things just go down. So let's be clear on that. These are general directionally true statements, but they're different in different scenarios and different categories. So when there is dysfunction or damage to the vagus nerve, then the heart rate can become accelerated, leading to tachycardia. Okay, so that's kind of how that is all related. Then additionally, let's talk about blood pressure and the baroreceptors of your vagus nerve. So baroreceptors, you can see how they're spelled here in the chat. Baroreceptors. Baroreceptors are located primarily in the sinoatrial node, the very top branch of your heart. They feel pressure, and they feel the pressure that they feel is converted into electrical signals that travel, electrochemical signals that travel up your vagus nerve into your brain stem. Your brain stem then takes a lot of data and goes, okay, the pressure in the heart is very high. We should send signals to slow down the heart rate by stimulating down the vagus nerve to release acetylcholine to slow down the heart rate, because that's how the things are balanced. If you have a high blood pressure, you want to slow down your heart rate. If your blood pressure is low or your vagus nerve is receiving signals that may be false that are indicating that there's low blood pressure, then the autonomic system in your brainstem starts sending signals to turn off your vagus nerve so that your heart rate goes up. But sometimes, because of infection, of damage, of compression, your vagus nerve can start to sputter and spit out electrical signals, electrochemical signals that are not accurate. So you can get a misreport of your blood pressure. That can cause different heart rate issues as well. So baroreceptors are obviously located in the walls of major blood vessels, including those in the heart. They detect changes in the blood pressure, and they send signals to the brain via the vagus nerve, triggering appropriate responses to maintain blood pressure within a normal range. Key thing, stimulating your vagus nerve allows your body to regulate blood pressure and heart rate within a normal range. It doesn't mean that number goes up or number goes down. It's just not, that's not how this works. So when your blood pressure increases, the baroreceptors signal the brain to activate the vagus nerve on the downstream, which then releases acetylcholine. This causes the heart rate to decrease, resulting in a reduction, ultimately, of blood pressure. Conversely, if blood pressure drops too low, the baroreceptor sends signals to the brainstem, which then says, well, let's increase the heart rate, which will raise blood pressure, right? So it's a delicate feedback loop that maintains cardiovascular homeostasis. And if your vagus nerve is damaged on the up or on the down, that's when things start to get a problem. If you interrupt the feedback loop, the information processing cycle, that's where you start to get issues. That's why a healthy neck is important. Did you know that you can pinch your vagus nerve through a bad posture, whiplash injury? You can eat yourself into vagus nerve dysfunction. You can drink alcohol too much and develop vagus nerve dysfunction too. Starting to see a pattern here. So let's talk a little bit about the vagus nerve and how to stimulate it, or what does that refer to? Is there a potential benefit to stimulating the vagus nerve and interacting with this? It turns out that given the significant role of the vagus nerve in the heart rate and blood pressure regulation, researchers have explored the potential benefits of vagus nerve stimulation as a therapeutic intervention. Vagus nerve stimulation involves the use of electrical impulses or ultrasound to stimulate the vagus nerve, thereby modulating its activity and influencing heart-related functions, as well as other functions. There's many more things that the vagus nerve regulates. But studies have shown that VNS can have a very positive effect on blood pressure, heart rate, and other cardiovascular parameters. By stimulating the vagus nerve, VNS can help lower blood pressure in individuals with hypertension. It has also been found to reduce heart rate variability, which can be beneficial for individuals with certain cardiac conditions. Remember, I've told you that there are certain rates of HRV where if it's saying 250 milliseconds, HRV can be too high. Most people don't ever experience that, but there are conditions where your heart rate variability can read way too high, and then you actually want to stimulate the vagus nerve to bring that back down to like 100 or to 90. That's optimal. Between 100 and, I'd say optimal HRV depends on age, but if you're 50, could be between, I'd say if you're an athlete, 60 to 100. That's optimal. If your heart rate variability is reading as 250, that means that there are some skips in your entire heartbeat. That's way, way, way bad. That can be really, really dangerous. So even stimulating the vagus nerve doesn't just increase HRV. Stimulating the vagus nerve brings things back into the proper homeostasis for your body at the time that it needs it. That's a really important thing to know. Furthermore, VNS has shown promise in treating various heart-related disorders such as heart failure and heart arrhythmias. The stimulation of the vagus nerve can improve cardiac function, enhance exercise tolerance, and even reduce the risk of sudden cardiac death. So, if you have some pre-existing conditions and you are concerned about your heart health, maybe incorporating VNS could be a good option for you. Who knows? Let me edit that R out of there. So, in conclusion, since we're talking about tachycardia primarily, tachycardia is often associated with vagus nerve dysfunction. This highlights the intricate relationship between the vagus nerve and heart health. Dysfunction of the vagus nerve can lead to an accelerated heart rate, while proper functioning does help maintain a balanced heart rate and blood pressure through baroreceptors and that information feedback loop that we talked about. Vagus nerve stimulation offers a potential therapeutic approach to regulate heart rate, blood pressure, and other heart-related functions. As research continues to uncover the complexities of this vital nerve, further enhancements in understanding and treating tachycardia are expected, bringing hope for improved cardiovascular health in the future. Thank you very much. Now, let's continue the dialogue here a little bit, because one other aspect that I think is relevant is a recent bit of research that I encountered. It found that in the case of heart damage, that they used ultrasound to stimulate the spleen, which is a place where immune cells are located. And they did a comparison. They did ultrasound of the spleen in a model of heart failure, of ischemia, which is basically when your heart cells die because of deoxygenation. So lack of oxygen can kill heart cells for too long. So they can induce that artificially. Now they have to induce a repair cycle in the body. They did a comparison between ultrasound to stimulate the vagus nerve in the spleen, and they found that the heart within 3 weeks repaired itself almost completely, like 100% back to normal controls within about 3 weeks. When they did ultrasound of the heart directly to the place that was damaged, they saw minor, if minimal, improvement. So it was the effect of stimulating the vagus nerve that allowed the heart to be repaired properly. Probably that's because when you stimulate your vagus nerve, you can increase stem cell production, stem cell proliferation, progenitor stem cells to proliferate throughout your body. So that can be a really, really good thing. That can be important in stroke damage, in tissue damage, in heart failure, any number of things. So I think it's pretty clear that finding some way to incorporate VNS into your self-care is a really good idea. It's not only protective to prevent you from developing a disorder or dysfunction of the body. Now, it can't prevent everything. Like if you're stimulating your vagus nerve, but you're eating Taco Bell every night, I mean, all bets are off, right? If you're eating processed junk food and drinking loads of alcohol and smoking cigarettes and I don't know, doing crack cocaine. I don't know what people are into these days. Whatever is big on TikTok. It's not gonna do that much, but if you live a healthy life and you stimulate your vagus nerve, you can expect to have a pretty relatively good outcomes is the best I can say. I don't want to land myself in legal trouble for somebody who's like, well, you said that if I stimulated my vagus nerve, then I'd live forever. I didn't say that. I didn't say that you'd live forever. I'd say it increases your likelihood of living a longer, successful life. That's it, right? Whatever else you do, it's like what you go skydiving and the parachute fails, but you were stimulating your vagus nerve and you crash and you die. I mean, what are we talking about? It's not making you immortal. Certainly not going to make you immortal from falling out of the sky, but in day-to-day normal healthy living, if you manage and mitigate risk, you should have a pretty good experience with it. So yeah, that's it. That's what I wanted to say on the subject. So keep yourself in a healthy heart state, and you should live relatively for a long time. So thanks so much for watching. We're gonna end it there. I gotta wrap it up because it is like 85 degrees and I am dying in here in the office. So we're going to end the stream on YouTube. Thanks, YouTube. Love you guys. See you soon. Bye-bye.